Thank you, Glenn.
Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
So with spring break coming, people are having this discussion. Where are they most vulnerable? Is it on a plane? Is it in the airport? Is it the place where they go? Or maybe it's all three?
It's all three, Larry. When you get out there into the public, some people have not had COVID. Most people have not had the vaccine. You're out in the public. If you don't socially distance and wear a mask, you're at risk.
And is it true, we had somebody say yesterday, that anytime there's been heavy travel, the numbers have gone back up?
Yes. That's just more mixing of people at risk. And that variant is out there now. So, 3 months ago, the risk was X. Now it's 2X. It's doubled at least.
Let's talk about the CDC guidelines for once you've been vaccinated. I know you've probably touched on this in the past, but people keep having these conversations with me, and I'm sure in their own homes. I've been vaccinated. What, am I going to stay in a bubble forever? I mean, what if people don't get vaccinated? Only 70% of the population gets vaccinated. How long is this going to go on once there's vaccines out there?
Robin, that's the whole story here. How long does it go on? It's going to go like in an onion skin thing. Right now, you have these little family bubbles and friend bubbles. Vaccine only, VO. That's going to expand. It's going to start first with international travel, where certain airlines are not going to let you on the plane without a vaccine card. So it'll go there. And it'll start moving as the amount of people that get vaccinated increases. So right now, only 10% of the population's had the vaccine. So the group of people that can mingle is too small. But once that gets up to 40, 50%, a lot of things can open and can open safely.
Yeah, it looks like plasma now, is it off the table as a treatment?
Yes, yeah, I mean, it's kind of a sad story here. It came with such great hope. There was a huge effort. 500,000 people in the United States took convalescent plasma. You have to take the plasma from somebody who had COVID, and then you have to take the plasma out with the antibodies in it and infuse it into somebody else. This is not an easy thing. There was a lot of money spent on this, and a lot of people received it, 500,000 people. The United States never finished a study on convalescent plasma. The United Kingdom did 10,000 patients, and Canada did 1,000. They found out that it didn't help. So we learned from them. That's great. But why didn't we do it here? Why couldn't we do it here? We had so many cases.
Well, let's get to some viewer questions. This person says, I had COVID in early February. I was told I am not contagious now, but will test positive for a while. I was also told not to get the vaccine until mid-May. Do I have the same immunity as those who are vaccinated?
Well, this is a really good question. No, you don't. Because the immunity after COVID varies between people. Some people have a whole lot of immunity. Some people have very little. And the immunity from the vaccine is pretty standard. Everyone's getting basically the same challenge, the same dose. And sometimes with vaccines give better immunity than the actual disease. So it's not the same. And so you take that in 3 months after your COVID, you take the vaccine, and then you'll be really fine.
All right, next question. We are hearing about CDC guidelines for fully immunized people, including safe bubbles in our immunized bubble. Can we include those who aren't vaccinated but who have fully recovered from a COVID infection?
Well, this is another really good question because, of course, we don't have an answer. So the people that just recovered from COVID, they're not even supposed to take the vaccine, or they're recommended to wait 3 months. So what about in that 3-month period? It's probably safe. I think there's a little bit of wiggle room there. I would be a little bit careful. I think this kind of slipped through the guidelines right now. But really, your bubble is safest with some people who've taken the vaccine.
All right, last question. Please provide guidance on donating blood after receiving a vaccination. I had my first shot last week, and my second shot is in 2 weeks.
Yeah, this is another good question, because don't be afraid to donate blood. We need blood. There's always a shortage of blood. So the 3 vaccines that are available now in the United States are not live attenuated vaccines. I mean, they're completely synthetic. You can go donate blood on your way out of the vaccine center. You go right over to the Red Cross and yeah, you don't have to wait at all. If you're in Russia or China and you took one of those attenuated vaccines that don't work as well, but they work, but not as well, you have to wait 2 weeks.
All right, Dr. Murphy, thanks again. If you have a question for the doctor, post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks again.
Great. Have a great day.